there have been renewed calls to discuss the pressing need to prioritise and allocate resources for women's health beyond the narrow scope of maternal and newborn care. Research shows societies that prioritise women's health show increased productivity across generations. So what are these economic implications of investing women's health throughout their life cycle? Well, before we get to that question, we're joined by Dr. Magda Rabalo, the president and co-founder of the Institute for Global Health and Development, who joins us virtually from Nairobi. Dr. Rabalo, thank you so much for your time this evening. Now, you're a former Minister of Health of Guinea-Bissau. You had a 20-year career in various positions with the World Health Organization. So when it comes to health on this continent, you've really seen it all. And all is what you believe those in decision-making positions in health should be looking at when it comes to women's health. Look at the whole person and everything that could be affecting both their livelihood and their health. Why do you think that's important?
Thank you for having me and for bringing this important subject for discussion tonight. I think it is extremely important to focus on women's health throughout the life cycle. Women are more than just their reproductive health and reproductive life. Women are important from birth to death. They have health issues from birth to death, which need to be understood through research. Women need more diagnostic tools, better medicines, and they need better understanding of their health needs, which doesn't happen because research doesn't focus on women. Investment to understand women's needs and to provide the interventions they need is just not funded, and we need to revert that. It is true that maternal health is important, reproductive health is important, and we have very high levels of maternal mortality on the continent, which need to be addressed. But that's not enough. You really need to look into the life cycle of women so that they can lead productive lives, they can invest themselves in the economies of their countries, and they contribute. Women are half of the population. There is a lot they contribute. They remain in the margins of society. They work in the informal sector. Their contribution is not valued. It's not counted. It's not made part of the overall wealth of the country, and that needs to change. Of course, if women are healthy, if they have better mental health, if they cancer are diagnosed at the very early stages, or they can even prevent cancer, if the cardiac challenges, cardiac diseases, diabetes, hypertension are taken care of with prevention, which is better than cure, the entire society will benefit more, it will be more productive, and then our nations will thrive.
It's really not rocket science what you're telling us here, because a golden thread throughout the continent is that women really carry the lion's share of providing economically for their communities, for their families in various sectors, like you just mentioned, especially in the informal sector. What kind of reaction have you had in the various boardrooms, meeting rooms and gatherings where you've put this on the table to say we need to look at the entire human being that is a woman and what they are doing on this continent, whether it is with regards to their nutrition, whether it is with regards to them preparing for menopause, or indeed their mental health?
Well, unfortunately, we don't have enough voices yet to really push this agenda forward. And this is what we intend to do when we go to the Conference on Public Health in Africa in November in Lusaka. We have a session which will look into the healthcare needs of women throughout the life cycle, from birth to death. What are the needs that women have, and how can we invest more in research to understand the health needs of women, to understand how can we improve the quality of care, how can women better have access to healthcare. As you know, the society, societal norms and structures and barriers prevent women from freely accessing healthcare when and as they need it. They depend on their husbands, they depend on their fathers, on their parents, they depend on their partners to be able to access healthcare. Because most of the time they don't have money for transport, they don't have money to pay for the services, they don't have money to buy the medicines. Or if they want to use contraceptives, they are not allowed. So we really need to understand how can we free women from these barriers that prevent them from accessing affordable, equitable, and quality health care so that they can live longer lives. It's true that women live longer than men, but they need to live long, quality, healthy lives, not just living longer. You really need to add life quality and health to your life expectations so that you can be as productive as long as you can be and take care of your community, of your society, and be counted for. Women do a lot of, if not most of the decisions in terms of family health care, and that needs to be valued, that needs to be appreciated, and that needs to be used for decision making for the nation, for governments, for societies to make decisions about where do we invest more, where do we put our money, and the health of women is definitely an area where we need to be investing more. So we'll be discussing this in Zambia, in Lusaka, but even before we get to Lusaka, even before we get to Zambia, there is Universal Healthcare Summit that is happening in New York in September. We need to bring the life cycle of women's health to the fore and say, just as the neglect has to end, we need to invest more in research, in interventions, in quality care for women. We need to have a better understanding of women's healthcare needs throughout the life cycle.
We know that we've got a long way to go on the African continent when it comes to a better representation of women in decision-making positions with regards to health, both politically and in the administration of our various health departments, in our hospitals, in our various health structures. How much of an impact does that lack of representation of women have on how these decisions are being made in terms of how resources are committed and just general strategy and direction of our health policies?
Well, we used to say nothing about us without us. If decisions are made without you, definitely they are not going to benefit you, and you may have the last share of it. So women, unfortunately, have not been given opportunities, even when they are competent, capable, and have the skills, experience, and knowledge to do the job. They are not prioritized for decision-making positions. They are not prioritized in government. There are very few women prime ministers. There are very few women presidents. You don't see women in executive boards. You don't see women in the political sphere. When you go to parliament, there are very few countries in Africa where actually you see a large share of parliamentarian seats that are occupied by women. So women are not sitting where decisions are being made. And when they are not there, of course, they cannot, and the evidence shows that when women are part of decision-making, they tend to privilege decisions that will benefit women, decisions that will benefit children, family, the society. And if they are not part of the decision-making process, definitely societies tend to lose on that front. We need to continue fighting for gender equality. Women need to be given the right seats in parliament, in the political space. Women need to be in government, not just the traditional portfolios of women, family and social care and health, etc. Women that are competent women who can be leading portfolios of science, finance, prime minister, president, so that we can make the right decision to benefit the entire society and benefit women. When you educate a woman, you educate the entire family, and then you can educate society.
Okay, we're going to leave it there. Thank you so much for your insight this evening. That is Dr. Magda Rabalo. She is the president and co-founder of the Institute for Global Health and Development, joining us virtually there from Nairobi. But as you heard, they're preparing for some very important international and continental meetings with regards to health over the coming months.